Good morning. Good morning. This is the AFP Industries Open Enrollment Meeting for 12/1/2015. My name is Nancy Grasso. I'm with Digital Benefit Advisors. Each of you should have an actual packet in front of you. In that packet should be a few items. One is an enrollment guide. This is for your use throughout the year. This will give you an opportunity to look back at all the information we've talked about today. You also have a Guardian booklet that has information about the Guardian plans that we'll talk about today. There should be a price list in there as well on a separate sheet, and then an employee enrollment form. All of those items should be in your packet. We'll actually follow this PowerPoint loosely, but we'll also refer you into the packet on occasion. Today we're going to talk a little bit about open enrollment. What is open enrollment? What you can and cannot do during open enrollment. We'll help you understand your benefit plan options, explain them to you, show you what has changed and what has not changed. We'll tell you a little bit about what we do and how we engage your organization and how we can serve you better, and then just the logistics of paperwork and what you need to do after we're through with the presentation. Open enrollment is the time of year when you're allowed to make changes to your plan. Open enrollment only occurs once during the year, and your open enrollment is during the next 2 weeks. During open enrollment, you're able to change your plan design, change the benefits of your plan, change the dependents that you insure, come on the plan for the first time, or come off the plan. If you have been if you've been eligible for the plan before and you didn't get on the plan on a timely basis, this is the time of year that you can now come on the plan. If you decide that you're not going to come on the plan or you're not going to make any changes, whatever you select at this point in time will be your plan and your dependent status for the remainder of the year. You cannot make any changes. So if you elect a plan now and then you decide that you want to change it in 6 months from now, you're not able to do that unless you have a qualifying event. A qualifying event is generally a change to your family election. It's usually a change to family status, such as marriage, divorce, the birth of a child, the death of somebody in your family. One thing that constitutes open enrollment that most people don't know is that if you actually have a spouse that's on your plan, or if you have a spouse that's not on your plan, but they have coverage through their employer, and their employer goes through open enrollment, then that automatically opens your open enrollment. So if you're at a time when you're not sure that you want to add your spouse because your spouse has coverage available to them, but you fear that it'll change, don't worry about it, because when your spouse's plan goes to open enrollment, it gives you an opportunity to add them back onto your plan if you need. Once you make these plan selections, once again, you can't change them throughout the year unless you have some sort of a qualifying event. Your anthem renewal is effective on 12/1, so all of the discussion points that we'll have today will go into effect on 12/1. A couple of things that you need to know about insurance. I know we've gone through this before within your group, but just wanted to reiterate, all of the plans have some sort of these features in them. Every plan has a deductible, there's co-pays in certain places, co-insurance, and maximum out-of-pocket. And we all know that the deductible is the amount of money that you pay upfront before the insurance plan will kick in and pay any benefits. And so what we want you to look at during this period of time as you're trying to select your plan is how much the deductible is and where it kicks in and where it doesn't. Sometimes some of the plans have the opportunity to have a co-payment or a flat fee paid by the insurance company without even having to meet deductibles. So you need to look at those things carefully. Co-insurance is expressed as a percentage generally, and so sometimes we'll see it as 70-30 or 50-50. Sometimes we'll see it as 80-20, and sometimes it's different in the network than out of the network. So we want you to be looking for those things. Sometimes people will say to me, well, Nancy, how could we have a co-insurance feature that requires us to pay 20 or 30% of a bill? What if I had $1 million bill? I certainly can't afford $200,000 or $300,000. Well, every plan has embedded in it a maximum out-of-pocket. And that maximum out-of-pocket actually drives the premium for a plan. The maximum out-of-pocket basically says, how much does each individual or family have to pay out of their own pocket, of their own money, before the insurance plan asks them to stop paying? And so you'll see all the plan designs that we go through, all of them have an out-of-pocket maximum, and that's something that you should look at closely. All of the plans that we'll be demonstrating today and talking about today have a preventive care coverage at 100%. So all of the services around preventive care, immunizations, annual checkups, colonoscopies, pap smears, all of those things are all covered at 100%. That basically means that if you go to a physician's office or a lab to have any of these appointments or tests done, there's no copayment, there's no deductible. You walk in, you get the service, you walk out, you don't owe anything. It's 100% coverage. One thing to note here is that a wellness vision exam is included for a $15 copay in your plan. Now we'll talk a little bit about the plans. These plans are also available to you in your employee booklet. So if you want to turn into your booklet to the plan grid, sometimes they're a little bit easier to read than this chart. Having said that, we'll talk about the plans from left to right. The very left blue column on this screen shows the benefit, and then the actual first plan, in the middle is your Health Keepers Value Advantage POS plan, and then all the way to the right is your HSA High Deductible Health Plan option. So we'll talk about them both briefly. Neither of these plans require referral, and both of these plans work on what we call a calendar year deductible. That means your deductible will start on January 1st and will end on December 31st, even though this plan is changing on 12/1. So from 12/1 to 12/30, even though your plan is changing, you still have the rest of the deductible to meet for the rest of the year, and then it'll start again on January 1st. Your annual deductible in the Value Advantage plan is $1,000 for an individual and $2,000 for a family. Your maximum out-of-pocket for an individual is $5,000 and $10,000 for a family. So if, individually the wheels fell off on your health and you had some really bad, significant issues, the most that you could pay in a year for each individual in your family is $5,000 or $10,000 collectively as a family. Your physician office in this plan is a $30 copayment, and you'll see that this identifies PCP, which stands for a primary care physician. Even though it's not required that you get a referral, if you go to any primary care type doctor within the network, you have a $30 copayment, and then any specialist in the network is $50. Urgent care, which we usually generally in Virginia look at Patient First as one of the providers of that, is a $30 copayment if they're doing services that are PCP type services, meaning that if they have, if you're going for a cold or a flu or an ear infection or something that's generally a general practitioner could service, that would be a $30 copayment. But if you're going into Patient First to have stitches or a cardiac workup or a bunch of tests or something, that could be a $50 copayment because that would be a specialist type service. And if you're not sure, you may want to call ahead of time or ask ahead of time what type of service that would be. All other emergency, inpatient, outpatient, diagnostic labs, anything done in the hospital or any kind of high-end lab work will be subject to your $1,000 deductible and then a 30% coinsurance until you meet your $5,000 individual out-of-pocket max. Your pharmacy prescriptions are on a 4-tier drug. This is a little bit different than what you're used to seeing. 10 for generics, 30 for tier 1, 50 for tier 2, and this last tier are specialty or injectable type drugs. That's a 20% coinsurance up to $200 per prescription. So if you're taking a $2,000 monthly injection, you would only pay, even though 20% would be greater than $200, you would still only pay $200. You have a mail order program that's available to you. You can see you get 2.5 times the benefit for a 3-month supply. So you pay 2.5 of the copay, you get a 3-month supply. And then your non-network benefits, all your plans have a non-network benefit within them. It looks like you can't see it on the screen. In your booklet, you can see that your non-network benefits increase your deductibles and your coinsurance and your max out-of-pocket. But again, the Value Advantage plan is a point-of-service plan with an open access, no referrals. But if you have to go into the Health Keepers network, if you should decide that you want to go out of the Health Keepers network, that's where you would be using non-network providers. If you had an emergency service outside of the area, that would not be a non-network benefit. That would be treated as in-network. But if you chose to go to, the best of the best doctor out in California somewhere, and you chose to do that, then you'd be subject to your non-network benefits. We're going to move to the Anthem Lunos High Deductible Health Plan. This plan also does not require referrals. It has a calendar year accumulator like we talked about, so it'll start on January, end on December 31st. Your deductible increases here to $3,000 per individual and $6,000 per family, and your out-of-pocket is $4,000 per individual and $8,000 per family. And you can see that your preventive care is covered at 100%, and so are all of the services that you could have rendered after you meet your deductible. So the way that this plan works is you have a $3,000 deductible, and everything that you do, prescriptions, doctor office visits, hospitalizations, everything that you do, you will pay for. You'll get the discounted rate of Blue Cross Blue Shield, but you'll pay for it 100% until you meet your deductible. Once you meet your deductible, you have no other expenses for any of those items with the exception of prescription drugs. And you can see that your prescription drug tiers revert exactly to the same as the Value Advantage once your deductible is met. This drug copay is the only way to get from your $3,000 individual out-of-pocket to your individual deductible to your $4,000 individual out-of-pocket. You can see that your deductible is $3,000, your out-of-pocket is $4,000, but if everything's covered at 100%, the only way to get from $3,000 to that $4,000 out-of-pocket is through these co-payments on prescription drugs. You also have a non-network benefit in this program. The HSA plan, the High Deductible Health Plan, gives you an opportunity to open up an HSA if you haven't done so already. And the benefits of an HSA are really that although you have a high deductible health plan, you actually could put money away in a bank account called the health savings account to help you pay for expenses under the deductible should you have an expense. So if you have to go to the doctor or you have a pharmacy, all of that money is going to come straight out of that HSA bank account through a debit card or a credit or a check. So really, if you think about it, an HSA is just a bank account that you open, and you're allowed to have that bank account because you have a high deductible health plan. What's really interesting is all the money that you put into that account, you don't pay taxes on. You don't pay taxes on it when you put it in. You don't pay taxes on it when you take it out, as long as you're taking it out for the purposes of medical expenses. The interesting about this account is that once you set it up and the money goes in there, it's yours. So if you're putting money aside, we as an organization, AFP will help you to set up this account. Digital benefit advisors will help you to do that. But having said that, it's your account. I can't look up the balances. I can't tell you what withdrawals you made or what deposits you made. It's your bank account and you own it, and therefore it isn't use it or lose it. You get to keep it and keep it forever. It's yours. So if you were to leave your job or get fired tomorrow, you could take that account with you to your next employer, and you could continue to use it. Basically what happens is you can't put any more money into it unless you have a high deductible health plan, but all the money that you put in, you can save and you can spend down. If you decide that you don't want to spend it down or you're healthy and you don't go to the doctor and you have no need to spend it down, you can actually accrue that money and then use it toward retirement. There are some specific rules around HSAs. You have to be covered under a qualified high deductible health plan, which the $3,000 high deductible plan is a qualified plan. Like I said, if you were to leave this organization and go to another organization, you'd have to have a qualified high deductible health plan to continue putting money in your HSA. But again, you could take money out of your HSA for medical expenses regardless of what kind of plan you have. You cannot be covered by another health insurance plan, including your spouse's plan. You cannot be covered by a medical FSA or your spouse's FSA. Basically, if you're taking money and putting it aside tax-free, you can't also use an FSA to mitigate the same claim. That would kind of be double dipping on taxes. So you're only allowed to have an HSA or an FSA, but not both. You cannot be enrolled in Medicare, TRICARE, or Veterans benefits. The website for Anthem is anthem.com, and the two plans that you're looking at are the Health Keepers Network for the HMO and the Key Care Network for the PPO. So the high deductible health plan sits on a PPO platform. So therefore, if you're on the high deductible and you need to look for physicians or facilities, you can go through the Key Care Network. when you go to anthem.com, it's going to ask you what network you're in, and please make sure that you know whether you're in KeyCare or HealthKeepers in order to search the right network. We are making a change to some of our other benefits. The dental benefits are going to change effective 12/1. We have the same plan design with a new carrier. So Guardian is our new dental provider, and so the plan works as follows. You have a PPO, which means you have in-network benefits and out-of-network benefits. And so Guardian has a pretty large network of doctors. They also pay very well to doctors out of the network. That's one of the reasons that AFP has decided to make this change. Your annual maximum, which is different than an out-of-pocket on health, right? On your out-of-pocket on health, that's the most you'll pay until the insurance kicks in. This annual maximum is how much the insurance company is going to give you in total. So you'll get $1,000 per year in total for dental benefits. Your annual deductible is $50 per person and $3 per family at $150. But all your preventive services, cleanings, x-rays, fluorides, panoramics, just a basic oral exam every year, you get 2 of those, and they're covered at 100%, and you don't have a deductible. If you go out of the network, they're 80%. If you get major services, which are extraction, compound extractions, periodontal work, root canals, all that kind of stuff, that's major services, and those are covered at 50%, and that's after your deductible. And your basic services, which are your basic fillings and basic oral surgical procedures, those are at 80%. So you've got your preventive services at 100, your basic, which is mostly fillings, is what you'll see there, is 80%, and then your major, crowns, bridges, dentures, all that kind of stuff at 50. Orthodontics are not covered on this plan, and again, you do have an out-of-network benefit. The claims administration for this plan, again, the calendars and all that runs on a plan year. So your maximum of $1,000 reloads every January and runs through December 31st. And in addition to that, your deductibles run from January to December 31st. There's a rollover provision in this plan, and basically what that means is there's some parameters, and we can read on about that, how you can, any unused maximum, that $1,000 maximum that you get, there's a way to get a portion of that to roll over every year if you don't use it. Theoretically, most people don't use all of their dental maximum every single year. If you think about, what you spend on dental care, and this is per person in your family, everybody gets their own 1,000. So if you go and have cleanings and they're covered at 100% every single year, and you get your oral exam and all of that, it might run you, it might be $400 or $500 of this benefit, but you get 1,000. So it takes things like fillings and extractions and wisdom teeth and all those kind of things to run you up year over year into the 1,000. And most people don't have those types of situations every year. So what happens is if you actually use your $500, you use a $500 claim threshold, meaning you generally get your 2 cleanings per year and your oral exam and a set of x-rays every year, that runs you into about $500. You'll get an additional $250 towards your maximum for the future year. If you use an in-network provider, it'll be $350, and that will keep compounding itself year over year until you hit an additional $1,000 maximum, which means you technically could have your regular 1,000 and your additional 1,000. So in a year when you do have to have a lot of work, you can actually have access to over 2,000. The rates for the Guardian Dental Plan are lower than they have been, so the rates did go down this year. We also moved the life insurance to Guardian. So everybody in the organization gets a life insurance benefit. In the life insurance, you've got 1 times your salary or $50,000, whichever is lower. So if you have a $40,000 salary, you'll get 40. If you have an $80,000 salary, you'll only get 50. All full-time employees not only are eligible, but you actually get this plan. So if you're a full-time employee on the plan, you get this plan, and there's no cost to you. It's paid for by the company. You don't need to enroll. You automatically get it. There's an accidental death and dismemberment, which is an additional 1 times your salary. So if you died in an accident or an injury that due to an accident and it caused your death, you would get an additional one time your salary. So you'd get the benefit twice. There's a will preparation service included at no charge. So for those of you who need help preparing a will, part of your life insurance benefit allows you to have will preparation services. At age 65, the benefits for life insurance start to reduce. And there's a schedule, and it's in your Guardian booklet. There's an option to purchase voluntary life insurance. And so we've had this opportunity to purchase before, but again, it's a one-time open enrollment every time you have a new carrier. So what happens with the voluntary life insurance is if you don't buy it now, then in future dates you're subject to medical approval. If you buy it right now, regardless of your health history, regardless of the health history of your dependents, you're able to get up to $100,000 of guarantee issue. But if you forego this opportunity, then you will not be able to come on the plan without being medically underwritten. And if you can't be medically underwritten, you'll be declined coverage. But right now, there's this open window for you to come in regardless of your health history. This is available to all employees and their dependents. Dependent life can only be purchased if you select additional life on yourself as an employee. You can elect from increments of $10,000 all the way up to $500,000 or to 5 times your salary. But you have to have it in that 10,000 increments. You can't have, you can't have $35,000. You can only have, in increments of 10. If you elect voluntary life for yourself, then you can buy it for your spouse and your children. And your spouse's rate is based on your age. So when you look at that rate sheet, it's going to determine what age you are, and then it'll give you a rate for your spouse and your children, regardless of the age of your spouse. The most that you can buy is $500,000 for yourself, and $250,000 will go for your spouse. You'll get $250,000 for your spouse if you elect $500,000. It's basically 50% of what you elect. But again, only $100,000 is guarantee issue for you. So in order for you to get $500,000 of benefit, you'd have to go through medical underwriting. But if you wanted $100,000, then your spouse would get $25,000, and then the children 10. And again, these benefits gradually reduce as well at age 65. The organization has two types of disability. One is a short-term disability, and the other is a long-term disability. The short-term disability is actually sold to you on a voluntary rate should you want to purchase it. Short-term disability covers illnesses and injuries that last for a shorter duration, or for the first part of something that lasts a long time. So for the first 13 weeks of any kind of a disability, if you don't have this coverage, you have to figure out a way to pay your bills for the next 13 weeks. You can buy increments of, you cannot exceed 60% of your weekly income. So what we generally do is take your annual income and then divide it into 52 weeks, and then you would be covered for 60% of that. You can choose to buy less than that if you'd like to, but if not, you can buy up to 60%. It cannot exceed $1,500, and you buy it in increments of 100. So basically what happens is you have to buy at least 200 a week, but if your weekly income is $1,500, you can buy 200, 500, 600, but not to exceed 60% of the income. That will last you for 13 weeks, and then once 13 weeks is over, long-term disability will kick in. Now you do have a waiting period in order to get that 13 weeks to start ticking. So if you got it from the day you become disabled, you have the first 7 days that you have to figure out how to pay for, and on the 8th day this starts paying you. So the thing that you need to think about is can you support yourself, your family, your bills for the next 13 weeks without being paid at all? But could you pay your bills if you got 60% of your income that was not taxable? And so generally speaking, that helps a ton, and so this becomes a very inexpensive way to insure that risk. Long-term disability is also with the Guardian, and this is, again, something that all full-time employees just get. If you're a full-time employee and you've met your eligibility period at work, then AFP pays 100% of the premium. And the way that this works is the same thing. This disability will pay you 60% of your monthly income. So you have to wait 90 days. So again, that 13 weeks and 90 days kind of pair into each other. But once you met the first 90 days of being disabled and you're still disabled, then this disability policy will pay you 60% of your income, no more no less, 60% of your monthly income, all the way up until you receive Social Security. And so this says usually age 65, but for some people it's 67, and for some people you're granted Social Security disability earlier than your retirement age. And so this policy will actually make up the difference if your Social Security disability is less than 60% of your income. The maximum monthly benefit is $3,500. So if 60% of your income equals greater than $3,500, please note that this policy will max at $3,500. And that concludes the benefit discussion. All of that should be in your packet. Just a couple things to note before we close the meeting, and that is Digital Benefit Advisors has been the consulting firm that AFP has used for many years. And so we have a team that really understands your group and how your plans work and the dynamic of your group and all of that. And they're actually here to help you. We're all here to help you with any issues that you may have. I want you to know that you have direct access to these folks at this phone number. This gives you an opportunity to call if you have claims issues or customer service issues, if you need a new card, if your wife is pregnant or if you're pregnant and you don't know what to do. All those things, please feel free to call us. We're happy to help you. What you need to do next is complete your enrollment form. So there's an election form. You'll have to complete that whether you're taking the policy or not. Your medical application, only if you're making changes. We haven't changed the Anthem plan at all. And so, but if you want to add dependents, take dependents off, or if you've not been on the plan in the past, you can go ahead and get on the plan now, but you need to fill out an application to do that. And then complete the application for the Guardian plans. The Guardian plans, all of the life and disability, optional life, optional disability is all on that one application. So each of those areas need to be selected or declined in order to complete that packet. And so please make sure you do that. Your life insurance, if you're not making any changes, please make sure that you designate a beneficiary for your plans. All those election forms need to be turned into the Human Resource Department by Wednesday. So we need to get those in as soon as possible. Thank you for your time, and if you have any questions, please feel free to call us. And that concludes the webinar series for today.